The Watchman device is a device that we use for assisting patients who have atrial fibrillation. Patients with atrial fibrillation have a very high risk of stroke. We know that the majority of strokes, almost 98% of them, come from a blood clot that forms in the left atrial appendage, which is a little pocket in the left upper chamber of the heart. One of the things that we can do is we can close that pocket off with a small device called a Watchman device. This device goes up the leg, up the right femoral vein. We get across to the left side of the heart. We put this device into the left atrial appendage, and then we remove the catheter. So the Watchman device is used for patients who have atrial fibrillation, who need to take a blood thinner, but have some reason why they can't take it. Either excessive bleeding, excessive bruising, falling down, risk of falling. There are many reasons why a patient cannot take a blood thinner, but need some type of stroke prevention. This is where the Watchman device is used. Patients stay in the hospital overnight one night after the procedure, and they go home the following day. There's no restrictions to recovery after the procedure because it's really just one simple needle poke in your leg. So there's no restrictions. Patients go back to their full activities within the next day. After we implant the device, the patient goes on aspirin and their blood thinner, either Coumadin or a novel anticoagulant such as Eliquis or Xarelto, and they stay on that for a period of 6 weeks. At that point, in 6 weeks, the patients come back to the hospital, and as an outpatient, we do another transesophageal echocardiogram. And if everything looks good, we take the patient off of their anticoagulant and we transition them to aspirin and Plavix, which is a super aspirin. The patient then stays on that for a period of 6 months. At that point, we do the transesophageal echocardiogram again, and if it looks clean at that point, we can stop the Plavix and the patient just is on lifelong baby aspirin. The beauty of this device is we now are able to help patients prevent against stroke without giving them all of the side effects that were accompanying the blood thinner that they had to take. Since Desert Cardiology started the Watchman program, we have implanted well over 150 devices so far, and at this point, Desert Cardiology Center is the third largest Watchman implant center in Southern California.